This is a session that we hope is not on the schedule 5 years from now, but we also know that it's a topic that affects everybody in this room. So we want to be sure to give it the attention that it deserves, and we're happy to answer questions at the end as well. So I'm very happy to introduce Jocelyne Huitron, who's going to be speaking about her experience with cleft treatment insurance challenges.
Well, good afternoon, everyone. My name is Jocelyne Huitron, and I am a medical social worker in Houston, Texas at Texas Children's Hospital, and I have the interesting challenge of making insurance digestible, entertaining, sorta, and just something that can be accessible, right? I know that you all have lived this experience, and so I hope just to provide a little bit of advocacy and empowerment today. So that being said, I already shared a little bit about me, but I do want to highlight the fact that I work in a multidisciplinary team. And for the past 2 years, I have been able to meet the most incredible families, work with an amazing team, and just learn. I didn't realize how much I would love the cleft community. I didn't know much prior to starting, and now that I'm in, I can't get out. There's just something about this group of individuals that I truly, truly care about. And so, because I work in a multidisciplinary team, that means there's other specialties involved. So I do have the privilege of working alongside a neuropsychologist, a dietitian, genetics, we have PAs, we have a doctor, and then the most important part of that multidisciplinary team is the family and the patient. Although sometimes some families don't consider themselves part of the team, you are a member, an equal member, and you have the right to participate. I know that sometimes teams come in, there's a care plan, but that's your care plan, right? And so you're able to ask those questions. I want to echo some of the sentiments that have been shared today, that you have the right to challenge, get second opinions, and ask those ongoing questions, right, to promote those conversations. And I'm going to highlight throughout this presentation that you have the right to speak with your insurance, although that sometimes insurance companies can be intimidating, won't answer the phone, use really big language and jargon just to deter families from challenging. You can challenge, you can fight, you can advocate, and I hope that's something that you get from this presentation today. Okay, so I kind of spoke about this right now. So some teams don't have the luxury of having a medical social worker, a psychologist, even sometimes a coordinator, right, to help families navigate the system. And so all too often, families have to adopt this role of being the advocate. And so this is why I wanted to highlight a little bit on this slide. When you go back to your hometowns, back to your cleft team, you may have to be that advocate, and that's okay. So let's say we were going to highlight a little bit about like those challenges. And so I will be speaking directly about the insurance denials, but here are some other common challenges. Just being in a network with the hospital. I get a lot of consults based on not being in network, and so it's speaking with financial counseling, speaking with your hospital, asking for a list of providers who are in network, and then at times making sure that the surgeons are also in network. One of the other things to this is also Medicaid. There's strict guidelines to qualifying for Medicaid. It depends on the state. As we all know, the pandemic had a big impact in healthcare, and so they made these guidelines a little bit more accessible for families throughout the pandemic, but that public health emergency did end, and so a lot of families are being kicked out of Medicaid, and I want to make sure that everyone knows that these slides will be shared, and so feel free to take notes, but overall, I'm just providing that overview. The other big thing is aging out of Medicaid. We have the kids who qualify, but at the age of 18, if they don't qualify for the adult Medicaid, they're lost after that, right? They can fall through the cracks. And so part of my role, and sometimes why I get consulted, is to find those transitional insurance plans. So whether that is through your college, through the place of employment, military, finding that insurance coverage. Now, let's say you don't qualify for Medicaid based on your income and you have that private insurance. We have the struggle of deductibles, co-pays. This is just part of your life. You have other financial responsibilities. You may have other children. You might not only just be supporting your family, you may be supporting your greater family. Maybe you have other debts. And so making sure that we really do take into consideration those financial challenges. And then all too often, I also see families come into the hospital who do not have any insurance at all. Private insurance, no Medicaid, right? To qualify for Medicaid, you do have to be a U.S. citizen, a resident. There's some refugees who qualify for Medicaid, but there's those families who often don't meet those requirements. And so in the hospital that I work with, it is a luxury and a privilege that we are able to offer some type of charity care. It's based on an application. There is this extensive review and committee. But that shouldn't deter anyone, right, to receiving the health care that they deserve and that they need. And there's a lot of advocacy happening, right, for universal health care. My goal and my hope is that one day we'll get there. Unfortunately, that's not the case right now, but we're going to continue to fight. The other part of this is just incorrect CPT coding. I'm not going to bore you too much on that. That's usually something that the nurses do, the PAs, but it's important to report the proper procedures that are being done because that's what the insurance takes into account. And I'll speak a little bit more about that CPT coding. So it happens. We have those insurance denials. And so how can we be proactive and kind of prevent those? There's two things that I've picked up the past 2 years. Communication is key. And we've highlighted this throughout the conference, communicating and having that conversation that's ongoing. And that is also true with your insurance plan, although they might not be the most exciting people to talk with. Please have that conversation with them and know that you can. Some of the questions that I encourage my families to ask always is prior authorization needed for services? I had families that sometimes don't have surgery benefits included in their health plan, and then they face those denials. Are there any exclusions? And then I talked a little bit about that CPT coding. This is typically entered by that RN or that PA, and then they will let you know, right, if there's any issues with that. So I want to go ahead and talk about the timeline of communication. As it's been shared today, some families find out prenatally that the child that they are having has a cleft. And so once you get that information prenatally, you're able to talk to your insurance then and there. And then let's say you are someone who may qualify for Medicaid, you will have to wait until the patient is born, the kiddo is born, to have that Social Security number and then register for Medicaid, right, or apply for Medicaid. So prior to planned surgeries, I also encourage families to speak with their insurance. This is just to make sure that there is no other authorization that may be needed, and that if a claim is denied, that they're able to appeal. The other big thing that I want to talk about is that one of the things that was mentioned today is going and seeking a second opinion. Some families will travel out of state for that. And so if you have state Medicaid, sometimes your state wants you to stay within the area because there's someone there who can perform those kind of procedures. Now, some Medicaid will not pay for those appointments, for those surgeries, for that care. If it's out of state, you have to receive that prior authorization. So it's always important to speak with your insurance prior to going to a different place for care. All too often, I also see families just coming and they have no plan. And so having that conversation then and there is important. And that's my biggest encouragement, is just speaking prior to those appointments. So this is the boring CPT list that you can also find on Google. This is for the RN and the PA. This list is extensive, and so those are just some of the codes. I'm not a medical professional, right? And so there is a standardized book for all of this, and just making sure that your RNs and your PAs are putting these codes in correctly is key. So the inevitable happens and you do receive a denial. It's okay, we can fight it. And one of those ways is appealing. So One of the components of appealing the denial is just first reading it. What is the timeline? How many days are they giving you? Are they asking for a letter of medical necessity? The denial letter should tell you why they denied it and then how to appeal that decision. Now, like I stated, sometimes some medical teams do not include a social worker or a coordinator, and that responsibility falls on you. That is okay. You might have to be the one who is calling the hospital, calling the surgeon, reminding them, hey, I asked for this letter. Can you please provide it to me? I'm on this strict timeline. And I hope that throughout this conference, you found a little bit of that empowerment within yourself. So this is some of the common denial language that we receive. It depends on your actual insurance. It does not meet criteria. It's not deemed medically necessary. That's one of the biggest ones, right? Because sometimes we are fighting for cleft care to be reconstructive instead of cosmetic, right? Claim was denied to. So just look for these key letters. Always check your insurance correspondence whenever you receive it in the mail. So now I want to talk more about that letter of medical necessity. And there's 3 components, right? Include that specific diagnosis. Also, talk about why it's clinically beneficial for these services. So that whole aspect between reconstructive, right, clinical significance versus just cosmetic, and then detail the next steps, right? Always share that there's going to be ongoing care that's going to be received. So in addition to sending the letter of medical necessity, I want everyone to feel that they can share additional information that includes research, pictures, anything that your team may feel that is beneficial to include to the insurance plan. So this is just a template for Cleft. This is one that we use for most of the denials that we receive. And then, like I broke it down in a previous slide, we have the diagnosis, we have the clinical significance, and then we also talk about those next steps. And so this will be included. Of course, it's custom to our own hospital, but this letter, the most important part is to see if the provider can give their signature. It is up to the provider's discretion whether or not they want to sign the letter. That's just for legal purposes. Any letter has the right to be subpoenaed, and so just speaking and advocating, but for the most part, providers are more inclined, right, to give their signature to these letters. This is a specific one for dental work. We also see that sometimes these dental procedures are the ones that are a little bit harder to get approved by insurance. And so for this specific case, we also included that CBCT scan of the jaw. And so, as previously mentioned, sometimes speech therapy can also get denied. There's several reevaluations that have to be done yearly in person, including those treatment notes, including why it's beneficial, what are you working on in speech therapy, and sending all that to the insurance provider is helping you build a case to get these services approved through your insurance. And so then I want to touch a little bit about the transitional adult cleft care. If you qualify for Medicaid, you may also qualify for adult Medicaid based on other comorbid diagnoses. This just depends, again, on your state. Now, you can also apply for adult SSI. The SSA office makes that final determination, and so I'm more than happy to share that information with you all, but if you just Google adult SSI, you may qualify for state Medicaid. One of the biggest things we also encourage is marketplace insurance plans, school insurance plans, and then for the adult cleft care, you find that it's the same process trying to appeal those denials. And like I talked about, I just want to make sure that everyone knows that you're not alone, that support exists in every single level between just medical social workers, in that meso area, the ACPA, and then just Smile Train overall. We're all here to provide that support and just validate that this does happen. It's very common and you're not alone, but that support exists within healthcare. Thank you for your time, and I hope to stay connected with you all. Now I do have the amazing pleasure and privilege of welcoming Carolyn Ballou.
Let's give Jocelyne another hand because I'm sure all of us really have had some interaction with insurance companies. I know I have, and that was years and years ago. But I am a mother of a soon-to-be 40-year-old son who at the age of 4 always asks me and my husband for a baby sister. Mommy, don't you want one of these Ranger cars? Don't you want this? I want a baby sister. And sure enough, we gave him a baby sister, Iva. Iva was born with a bilateral cleft lip and palate, as well as what they call Peters times 2, which affected her eye. That being said, I had all of this information from the cleft palate clinic. They only met once a month. My mothers, my sisters, my neighbors telling me, well, you should feed it this way. Well, you should do this, you should do that. But what was missing out of my circle? There was no one there to tell me about how to get these bills paid and get her services approved. That didn't happen. So I appealed several times, whether it was speech therapy, whether it was hearing, dental, you name it. I've been there and done that. I just only wish that I had Jocelyne right there telling me how to do those perfect letters. And I'm going to show you the letters that I wrote to the orthodontist talking about Iva's treatment for braces and all this kind of stuff. Now, I started putting this together, and I thought, what am I going to do? Because I don't have any of that stuff. You know, this is back in 2001. Duh. So I said, I'm not going to dress it up. I want you to see how it was for me 30 plus years ago. So we had gotten a denial letter. In fact, we also got a letter asking for clarification. And one thing I made a big point about is anybody that came in contact with Iva medically, I want to know you're a nurse. I want to know your financial manager. I want to know the nurses. I want to know everybody in that office. And hey, how you doing? Because I know that I needed them to tell me something at some point. So it came to be with the orthodontist. This is a letter that Iva's orthodontist wrote on behalf of asking that they approve her procedure. And you see there, they said the fee treatment is $4,900, like it's peanuts. That's not including her speech therapy, that's not including just her regular physical, that's not including her plastic surgeon and all the other things. But he had no hesitation about helping me get this through. This is a letter. Now, go back. If you remember, the date of that letter from Dr. Levine was in 2001. This is now February 13, 2002, because I received another denial letter. And this is what I wrote based on what I felt, based on what I thought I knew. Because I'm an old school mama bear and an old school HR manager. You put those two together, we're going to have a dance. You see, I said that my contention is that my daughter has been and is still covered by your company. No other insurance company will provide treatment because of the pre-existing condition. You know, insurance likes to use that word. Robin, who I will talk about later, had a complete history of Iva's medical situation. And now halfway through the process, you want to deny her? Well, what do you think? How is Iva going to eat? How is she going to drink? How is she going to hear? How is she going to grow into a productive woman? Mama Bear came out. And you notice I quoted the Florida statute, which at the time I didn't even know what it meant. But it was a Florida statute that they said that cleft lip and palate should be repaired. So I said, they can't deny this. Let's send this. And I did. Now, I got to remind you, I was working on what I knew and what I felt, because no one else in my circle of family and friends had ever dealt with a cleft. It was me, my husband, Isaac, and Iva. And we were doing the best we could for Iva. Of course, for Iva made it kind of easy because she had a real champion spirit. She would say, Mommy, that's okay. And we made a point, my husband and I, that we would not discuss money and what we're going through with medical doctors around Iva. For the simple fact is, that's not her worry. It's our responsibility as parents to provide her needs. Well, they must have denied it again because I wrote another a letter to the reconsideration department. And I found out about the reconsideration department by calling and talking to one of the insurance representatives, and they said, well, send it to them. I said, okay, here you go. So I sent that letter. This is in August 2002. Let's see here. Here you go. What did they send me? They really told me about myself, didn't they? They said, on page 46 of your 2002 service benefit plan brochure, and under reconstructive surgery, and then they went on to say, what else did they say? Our medical review department has reviewed this claim. Remember I told you about sending it to the reconsideration. And your letters also included a reference to Florida statute section 627.64193. This state mandate does not apply in this case, as this is a federal contract which is governed by federal law. Okay, but at the bottom of the letter, they said that I could write to the Office of Personnel Management, Office of Insured Programs. They told me what to do, right? So I called and I got into a conversation with one of the insurance representatives, and they sent back and said that, and Jocelyne mentioned this, that he was in a non-participating provider. He did the work, he's going to do the work. Hey, not everybody was able to work on cleft palates and lips. So what did you want me to do? But I called, if you notice, there's a little note there, and I wrote notes on everything because I was a working parent. My husband worked. So I had to spend my lunch hours, I had to spend nights trying to get this stuff together. Russell said, send the denial to reconsideration. Said, statement of appeal, right, not shown in the system. So what does that mean? Okay, I got time. Another letter. But because of what the person told me, I took the time to write his manager, or to write back to the insurance company and let them know what a good employee they had. In my mind, I was thinking, if I have to call him again, he's going to be willing to help me because I congratulated him. I told his boss what a good provider and how he shared useful information to me. So I wanted to give him some kudos, right? So they wrote me a letter back and said that, thank you for taking the time to write and let us know how much you appreciate the service you received from blank for going the extra mile. Well, I'd appreciate it if they had went the extra mile and just gone and improved it. Let's see, is this a letter from Dr. Obi? No. Okay. Let me get this back straight. Okay. That's right. This next slide, remember, I told you that I made it a point to know and get involved with everybody that was involved with Iva's care. This is her plastic surgeon who was also the lead person over the clinic. He was the one who got the nurses, the doctors, and everything involved. He, in turn, wrote a letter to the insurance company, and he told them what the team was comprised of: professionals representing multiple disciplines involved in the care and rehabilitation of the multiple aspects required. We meet routinely to examine the patient, review their progress, and recommend additional treatment. And they talked about when the last time they saw Iva at the Cleft-affected and what needs to be done. So it wasn't even a problem for me to get the doctors to come forward and help us. He willingly did it because, you know, they're caring doctors, they love their work, they're good at their work, but they also want to get paid. Right? Remember that letter they asked me to write? I did. Office of Personnel Management. This is in December 30th, 2002, a whole year. Now, mind you, I didn't stop the treatment from going on. We went on and we paid the $900 to get it started because money is not going to be what keeps my daughter from getting what she needs when she needs it. So I wrote them again, and it was disheartening because finally this insurance company did not pay the full bill, but they did agree to pay him as a non-participating provider. That's why it's so very important that you keep up with your brochures, your health insurance plan that they give you, because it describes a lot of stuff in there of what they will cover and what they will not cover. But that's not necessarily the end. It's not. I feel that a denial is not a no. A denial means, okay, you're going to get a letter. And another denial means you're going to get another letter. As many times as you give it to me, I'm going to try to give it back until I've exhausted all the avenues that there is to get the help from my daughter. Now, your situation with insurance may be a little different from mine, but we still have a lot of similarities when it comes to dealing with the insurance companies. I felt at the time, 30 plus years ago, that I had no one to turn to, no one to ask for help. Even though we went to a clinic, they basically talked about the medical aspect of it, not the insurance part of it, which is so important. I wasn't eligible for this, I wasn't eligible for that, and it just went on and on. So as old school Mother Bear, gotta fight. I had to learn to take care of my baby in the insurance arena. The first lesson I learned in dealing with the insurance company was that denial is not the end all. You have to stick with it. I know you may not have 4 hours or 2 hours to stay on that phone holding or push this number. If you're waiting to speak to such and such, do this. But it's so necessary that we do that. Our children depend on us. It took a year, like I said, for a resolution to come. Through all the surgeries, I did reach out to everybody that I thought could help us, everybody. And I guess it all started, me being at Mama Berry's. She was born in September, and I went to pick up the ham from the Honeybeck ham store. And you know, with a new baby, everybody wants to peep in at a new baby. And I had her all wrapped up. And so people said, oh, a baby, let me see it. So I pulled back the little blankets and, ooh, what's wrong? Somebody else said, oh, did she have a hair lip? Someone else said, were you on drugs? That didn't sell with this mama at all. Before I knew it, I went into a zone. I started throwing all Iva's clothes off. The blanket went here, the hat went there, the shoes went somewhere. And I held up my child and said, this is my baby, and she is beautiful. And I'm going to get everything I can possibly get for her to make sure that she is a success and she does well in spite of. And I've carried that even to today. I'm not as bad, I'm not as involved, but I do stress the point of know your brochures, work with the entire staff in the medical community, in your doctor's office, and do what you can to support your child. Any questions? Thank you.
Well, thank you so much to Jocelyne for giving us a framework for this whole crazy insurance situation, and to Carolyn for giving us a snapshot into your story. I know it was just a snapshot of your story, and that we have 100 other ones here in this room today. So I just wanted to take a few minutes to talk about the Ensuring Lasting Smiles Act, what Smile Train is doing in support of this advocacy, and how all of you can get involved. All right, so one theme that both of our speakers touched on is that there are state mandates that differ depending on where you live. So there's a lot behind that, but the bottom line is that your insurance coverage depends on where you live, and that determines the level of treatment that you receive. So the Ensuring Lasting Smiles Act is legislation which aims to erase that gap and impose a federal mandate, which would ensure that people born with any birth difference, including cleft, receive the care that they need. I'm preaching to the choir here, but just to set the scene for why this is so important. We have all heard the term medically necessary. In many, many cases here, too many cases, it is the insurance company and not the medical provider who is determining what is medically necessary. This would stop that from happening. Something we've talked about quite a bit today is the need for adult treatment. And right now, many insurance plans simply cut off treatment at age 18, and we know that the cleft journey doesn't end there. Something that both of our speakers spoke about as well, orthodontic care is a huge part of the cleft journey, and it is the most commonly denied piece of treatment. And bottom line, which again, everybody here knows, is that denials cause treatment delays, they prevent patients from getting the care that they need, and they waste time and resources all around. Okay. So just to give you a little timeline of this legislation, the Ensuring Lasting Smiles Act was first introduced into the 115th Congress in August of 2018. It was reintroduced in 2021 by bill sponsors Senator Tammy Baldwin, Senator Joni Ernst, Representative Anna Eshoo, and Representative Drew Ferguson. Thanks to the effort of a huge ELSA coalition, which is led by the National Foundation for Ectodermal Dysplasia, of which Smile Train is a member, and the tireless work of a lot of people who are here in this room, so thank you. It was passed by the U.S. House of Representatives on April 4th of last year. Since the legislation was not passed by the Senate by the end of the year, it now needs to be reintroduced into Congress. So right now, the sponsor offices are working on updating the language, making any changes that needs to happen, and they're hoping to reintroduce the bill hopefully any day, so late summer, early fall at the latest. So I know I didn't need to sell anybody on this topic. What people really want to know is how you can get involved. So keep an eye on smiletrain.org/advocacy. That's where we will post all of the opportunities we have for our cleft community members to get involved. If you go there right now, you will see a fantastic video featuring Lucy Capo-Rome, here somewhere, talking about this legislation, and as well as our Director of Advocacy, Sarah Hamilton. As soon as the bill is reintroduced, there will be software on that site in which you can just put in your address and a letter will pre-populate to your local legislators. You can edit it, add whatever language you would like, and it will be sent out immediately. So our first ask is going to be that we all ask our local congresspeople to become co-sponsors of the bill. and NFED, which is the foundation I mentioned earlier, is hosting a Day on the Hill, September 18th to 19th. Registration is still open. It closes on August 11th. And while everybody is welcome and encouraged to register, Iva and I will be there from Smile Train. They are missing representatives from all of these different states. So if you happen to be from one of these places or know anybody who's able to join, Congresspeople only meet primarily with people who are from their districts. So thank you, thank you. And lastly, sharing your story. Many people don't know about Cleft, as I'm sure you've encountered, but have no idea about the insurance challenges, have no idea that this is a huge part of the story of this community, and they're only going to learn by us standing up and talking about it. So I hope we give you some tools to do that here today.